In this topic, we will discuss about the categories of diagnostic laboratories on the basis of how much test and what type of test are being performed in the laboratory. So here is a question: what is diagnostic laboratory? So diagnostic laboratory is actually a very specialized, a scientific place where different tests are conducted on different human specimens like blood, plasma, tissues, normal samples, abnormal samples to prevent different diseases, to diagnose different diseases, and to show any abnormality going on in the human body. So, this is a place where we examine different human specimen. We can categorize our diagnostic laboratory into few categories. The first category is the primary lab. How can we categorize the different diagnostic laboratories? We can categorize on the basis of test, number of tests, and the type of tests are available. For example, if we talk about routine tests, complete blood count, hemograms, and routine microscopic examination of urine in the laboratory, then we can say this is actually a primary laboratory because only a basic, very basic investigations are available, and only few equipments are available. So that's why we put such laboratories in the primary lab category. Another category is secondary laboratory. A secondary laboratory is actually a more advanced as compared to primary laboratory, in which along with routine complete blood count and routine microscopy, routine biochemistry can be performed, routine immunohematology, for example, blood banking can be performed, routine examination of all the fluids can be done, and routine immunoserological test can be performed, routine bacteriological studies, for example, culturing of the different organisms. Okay, gram staining, ZN staining can be performed, and complete hemogram along with smear preparation and blood pictures can be done. Then there is another category of test coagulation studies, prothrombin time, activated partial thromboplastin time, the thrombin time, and blood bleeding time, etc., can be performed on in this laboratory. So that's why we can place such laboratory in this as in secondary lab category. So another category of the diagnostic laboratory is tertiary laboratory. When we say tertiary laboratory, it means it is a more advanced lab in which all hematological testing are performed, like leukemia, like diagnosis of blood cancers, okay, like leukemias, and bone marrow investigations or electrophoresis, etc., and then complete biochemistry. In secondary laboratory, there is a possibility that few biochemistry tests cannot be performed due to expense or due to unavailable of more instrument. But in this advanced category, all biochemistry tests are done. In complete immunology, including ELISA, including RIA, all type of tests are performed in this category. Then simply complete microbiological examination can be done under this category, and all molecular exam, for example PCR or genotyping, are performed in this category of laboratory.